Thank you, Todd, and thanks to the Minister of Labor, the Honorable Philomena Tassi. We've had some questions regarding the presentations today, and not to worry. Today's sessions will be made available to all registrants 24 hours after we complete the summit. So watch out for that in your inbox. Now, we'll get right to our first session about the physical workspace and invite our panelists to the virtual stage. Introducing Richard Moreau, Director of Business Development and Emergency Management Solutions at Calian. Dr. Ken Jenkins, MD, National Medical Director, Occupational Health for Medicis. And Chris Tierney, Vice President, HR and Learning at the HRPA, Human Resources Professionals Association. And of course, Todd Humber moderating. Take it away, Todd.
Great, thanks, Kyle. And Richard, Ken, and Chris, thank you so much for joining us this morning. It's a pleasure to have you. So let's get into our discussion. Richard, I'm going to start with you. So let's start with the actual buildings that employees work in. What do employers need to do to prepare the offices and work sites? We know many of these buildings have been vacant with people working remotely or being closed down. Many of these job sites have been either shut down or working with reduced capacity. So what do you think needs to be taken into account before we welcome employees back?
So Todd, thank you. For us, it was slightly different as we didn't experience a complete shutdown because of the nature of our business. We have a mixture of manufacturing operation, office space, and a large portion of our employees are working at client-operated work sites. So very early on, once we shut down all the operations that we could and assess the situation, we had early on to tackle some decisions around bringing back people to work immediately within the first week of the shutdown being executed. So for instance, our manufacturing operation in Saskatoon was declared an essential service. So we had to quickly tackle with making the necessary adjustment in terms of physical distancing, PPE, shift schedule, and closing down all common areas to minimize the chances of contact between workers, and bringing back only essential personnel to run the facility. So we had to cross that bridge very early on. And also some of our clients were performing services that were deemed essential. So the challenge here was on a contract by contract basis was to have an informed discussion with each client to make sure that they were putting in place the measures that would give us a degree of satisfaction that it was safe to allow our employees to return to client worksite. So that was really mission number one. So that experience very early on into our response to COVID-19 has provided us some early insight into some of the planning considerations that we needed to take into account in order to eventually prepare for a more broadly applied return to work plan on a site-by-site basis. So that also allowed us to gain a little bit of time to clearly understand how COVID was affecting our employees across the board, what their status was, what were our clients' needs, how could we help them, and finally focus on the status of our business. So once we've established that, in early April, we activated our planning team to begin the detailed effort of preparing for a more broadly based return to work plan. Now, the challenge for us was that we operate internationally and also across all provinces in Canada. We have a presence varying in size from province to province, and that posed a challenge in terms of planning our approach to return to work, because as we know, health is a provincial jurisdiction, and despite the fact that the federal government provides some guidelines, at the end of the day, it's up to each jurisdiction to decide how they were going to proceed. So for us, that caused us some additional assessments to be made to make sure that what we were doing at each work site was aligned with the guidelines and the plan that were provided by each provinces. So we needed to look at the details of their return to work, identify the conditions that needed to be met in order for us to even contemplate initiating the return to work. So we quickly came to the conclusion that we couldn't rely on a single or each of the provincial plan, that we needed to have our own to anchor our decisions on, and then basically compare it or harmonize it on a province by province or jurisdiction by jurisdiction case, and drill it down to each site. And for us, that meant publishing guidance for two groups. So all our contract managers and our service lines that interact with all our clients, where our employees were not at work, needed to be armed with the right guidance and consideration across a wide range of issues: occupational health and safety, PPE, work routine, what were the preconditions that needed to be existent in order for us to allow our employees to reintegrate a client worksite. So that was for one group. And then the rest of the guidance and detailed planning was on a site-by-site basis, where it was a Calian operated facility. So that included obviously liaison with the different landlords at each site, but also coordination with other tenants, because we quickly realized that it's fine for us to come up with a very robust and well-articulated plan, but if it's not harmonized with the other tenants in the building, then because we share so many common areas, or we transit through so many common areas, that lack of commonality, or at least standardization, could potentially cause additional risk exposure. So each plan comprise a series of key elements. So first of all, there was a decision support template established for each site in terms of the information, the metrics, and the criteria that were being used to make decisions about the return to work for each of the sites. The other areas that we developed planning considerations and measures were obviously occupational health and safety measures specific to each site. Return to workforce routine. So what would reintegration to work look like on day one for those who were being brought back? A clear communication plan to make our workforce aware of how we plan to proceed and how each site was going to roll out its return to work plan, and how it would affect the workforce specific to that work site. All the logistical requirements that need to be in place to bring the workforce back. So PPE, cleaning material, level of disinfection that needs to occur before we allow our employees to re-enter the workspace. Also, our incident management protocols in the event that we have a case in the workplace and we have to tighten up our measures again. So we need to clearly, we identified that we need to clearly inform all our managers and maintain a risk monitoring approach throughout the return. So in the end, our approach has been to bring back to work those who need to be back at work first, followed eventually by those who want and can return to work, and finally add some flexibility in terms of adjusting to the new reality for those who can continue to work efficiently virtually and don't need to re-enter the office space. So in the end, our approach has been to go as fast as possible, but also as slow as required, adopting a risk-based approach, close monitoring to what's happening in the environment that we operate in, and proceed very cautiously. There's absolutely no rush for our company to bring more people back to work than we currently have in order to minimize the risk exposure.
Great, thank you, Richard. Chris, I'm going to ask you a follow-up question on that. He mentioned briefly about common areas and things like that, and we know in a lot of buildings there are common areas, for example, like elevators. bathrooms that are a little bit more difficult to police. So what are some of the best practices for employers when it comes to those areas?
Yeah, thanks, Todd. I think that for HRPA, because we're an office-based association, and there are many organizations out there as well that are in a similar situation, one of the approaches is to work directly with your building management, with your landlord, especially if you're on a multi-tenant site, as Richard was saying, where you have other tenants in the same building. So what we're seeing is the landlords and the building management is putting guidelines in place, they're putting controls in place and getting those communications out to their tenants. So it could be things like, maximum number of occupants in an elevator. And even when you're in the elevator, where do you stand? How do you interact? Pushing the buttons, I mean, right down to kind of those menial tasks are being contemplated by the landlords. They're also, a lot of the landlords we're hearing are very active with signage or designating certain doors entry only, other doors exit only. What the point is, working with your landlord, it's easy for us to control our own work sites and put our own controls and monitors in place, but we lack a little bit of control when we're out in those public spaces, in those buildings. And even thinking about, I hear the idea of people using stairwells. Well, I'll just use the stairwell rather than go into the elevator. Well, when you think about a typical stairwell in an office building is probably no more than 6 feet wide if you're lucky. And so how do you control the flow of traffic and avoid people passing in close proximity in the stairwell? So every movement of the tenants, of your workforce, of your employees needs to be considered in those common places, and working with your landlord on the different controls and guidelines that they're putting in place.
Great, thank you, Chris. So Dr. Ken Jenkins, I'm gonna throw a question to you now. We've heard a lot about screening employees, right? So, employers are often screening staff, maybe taking their temperature, just asking them, basic questions. But most employers do not have a medical professional on staff, right? So what role, as we say here, what role can and should managers and supervisors play when it comes to screening staff?
Well, Todd, thanks for the introduction, and good morning to everybody. Our company represents clients in the mining and oil and gas sector and construction industry right across Canada. And let me tell you that it can be done. A number of our clients have maintained an open status during this time, and with the appropriate measures in place, you can have a successful return to work. And so let's talk about that and how you can get there. First of all, from a high level perspective, you need to have some kind of policy in place that protects the health of your workers. The occupational health and safety rules and the requirements from the Chief Medical Officer of Health are very vital and important to guiding the return to work practices. And we have to get away from employees coming back to work when they're sick. I mean, let's face it, in the past, people would have a cold, even a flu, and would show up at work, and those days are over. We're not going to be able to afford to have people presenting with the risk of transmitting virus to other workers. So you need to have a clear policy and procedure for what to do when a person is sick, how to contact their supervisor. Let's realize as well that notes from physicians are unlikely to be available. Most of the medical associations across Canada have instructed their physicians not to be providing notes for this time of the season. And we, as it's been discussed, certainly teleworking options should be provided to employees if you're able to do so. Things like staggered shifts and flexible work hours and schedules are also very relevant to this time of the experience. So let's talk about screening now, if you do want to decide to bring workers in, and how you should go about the screening process. Really, people should be screening themselves before they leave home. And there are a number of online assessment tools that can be used for this purpose. TELUS Health has one in particular. It's the COVID-19.telushealth B2W.com website you can go to, and it has a particular tool that can be used by jurisdiction. Most of the jurisdictions are covered, not all, because not all provinces and territories actually have a self-assessment tool in place right now. There is a one that applies to the GTA area that could be applied and used in all circumstances, however. If you're setting up at the work site and setting up a screening station, certainly the questions could be completed on a paper-based questionnaire. Employees could be asked questions by a screener, or you could use an electronic format. And I just want to move to the next slide now to show you one that was developed by Toronto Public Health. Basically, this particular format reviews the key symptoms of the COVID-19 illness: fever, cough, shortness of breath, sore throat, runny nose, and feeling unwell, and asks some key questions, including close contacts, travel history, and the like. And basically, if anybody answers yes to any of these questions, they really should be excluded from the worksite immediately. You'd certainly need to have proper signage in the area where you're doing your screening, and you'd need to have alcohol-based hand sanitizers available at the screening tables. Workers who do present a risk of COVID-19 transmission, as I said, should really be going home. If anybody screens out negative and don't have any particular high risk for this illness, they should wash their hands with a sanitizer, and they can proceed on to the office setting. There's a lot of questions about temperature checks and whether they're appropriate or not. Basically, most of the occupational medicine resources would recommend that temperature checks are not required. Some workplaces are doing this as an extra means of reassurance, but the science doesn't stand behind it as a truly effective means of screening people in and out. In particular, the types of devices that are on the market now, some are relatively accurate when it comes to measuring non-contact temperatures, and others don't have the degree of accuracy that are required for making decisions of this particular nature. It's also recommended that if you do move back into the office setting, that supervisors should check in with their staff at the end of the shift to see if they're symptomatic or not, and if they're looking like they're ready for work the next day. So what should you do if employees become sick at work and are symptomatic? Well, they should go home right away and self-isolate. And they should avoid public transport if at all feasible. You certainly don't want to have somebody cross-transferring infection to other people on the way home. They should contact telehealth, or if it's available in your jurisdiction, or their healthcare provider or an assessment center to get some guidance on whether or not they need testing. It's generally not recommended that employees be tested for COVID-19 if they don't have any symptoms at all. And you should have established criteria for return to work. In general, if people are asymptomatic after 14 days, they're able to return to work at that point in time. But there are no requirements for tests of clearance for returning to work, in fact. And that's my statement there, Todd.
I was just going to, sorry,
Yeah,
I was just going to jump in because Ken, I love this this little questionnaire from Toronto Public Health.
Yeah.
HRPA just closed a member survey earlier this week, asking our members about their organization's planning for return to workplace. And
Right.
one of the notes that I can bring up from that survey results is a small number of our respondents said that they plan to use a questionnaire or a survey such as this one.
Yeah.
So I think that there's a perception or there's a hesitation within the HR community or within businesses to use this type of screening questionnaire in the workplace. So I mean, I'd like to work within the HR community to help some of our members and some HR professionals get past those mental blockers to using a questionnaire. And I think that there is the hesitation perhaps comes from a perception of intrusiveness, and are we being overly intrusive in asking our employees these questions?
Yeah.
But for the benefit of the health and safety of our workforce, of our guests to our work site, and to the general public, I think this is a necessary tool to put into practice. So I was alarmed to see from our survey respondents such a small percentage that's already planning to use something like this, in particular when you have public authorities and public agencies that are providing such simple and useful tools for general use. So, but I just thought that was an interesting thing. You know, I agree with you, Ken. I think it's a great recommendation, but it was very interesting and curious to me to see such a small number. So just something for us to focus on, I guess, in our own organizations and in the people that we consult and advise as well.
Yeah, I appreciate the feedback, Chris, because you know, when we looked at a number of our clients and how we layer the defense mechanisms in for them, you know, we look at the point before, as I mentioned, they even leave home. So a self-check, you know, how do I feel today? Doing the self-assessment tool, making sure before you get on public transit to get in to leave to go to work or carpool or whatever mode of transport you're using. If we layer on those defense screening methods, it gives the very best chance of success with this effort. So thank you for your observations.
Great, thank you. So Richard, I'm going to move on to the next question. This one's for you. We had a chance to talk before this session, and you talked to me about a dashboard that employers can use to manage risk. So what is this? What does it look like, and what does it do?
So thank you, Todd. So as I stated in my previous answer, early on, we established that one of the key challenge that we're facing was the scope of our company and the number of jurisdictions we cover. So we realized that each provincial plan or national plan, as it applied, could potentially represent increased risk exposure to our workforce, depending on how it was articulated. So early on, what we did is we established our own criterias that we use to assess each of the provincial reopening plans and identify the level of risk exposure each plan could potentially bring on to our workforce. So we looked at the external, what we've called the external risks, and also some potential internal risks, which I'll get to in a second. So we used 8 criterias, and we started with the 6 World Health Organization criterias that have been pretty much applied by the vast majority of countries and jurisdictions in order to assist us in establishing that the conditions in each province were stable enough for us to consider reopening our office space and sending our employees back to client sites. And then we added 2 of our own, because as we started to look at the plans, what concerned us is some of the plans, the way they were articulated, were based on timelines, and there was no clear indication, or it was not clearly communicated, that the decisions to move from one phase to the other, or even to initiate the return to work plan or the reopening plan, was based on clearly identifiable metrics or criterias. So in those cases, we felt that those who went timeline based were at greater risks of not being able to fully contain or launch their reopening plan under the right conditions. Therefore, that would increase the risk exposure to our employees. So what we did is we developed a dashboard that has all of the provinces' assessments, the risk exposure that we've assessed that was being brought upon by the way they were proceeding, and also what are some of the mitigation measures that we were going to put in place in order to minimize the potential impact of the various plans on our workforce. So that was a key part of it. The second part, where to look at internal risks, one of the big ones that we identified early on was misinformation. So we felt that we needed to, the Calian Incident Management team needed to establish itself as the trusted source of information from where people would get their information about COVID-19. So our mantra became communicate often, communicate early. We even stood up our own intranet website to reach our entire workforce, where we provided daily updates, key messages around how to work from home, mental health issue, how to stay connected. So everything to really engage our workforce, keep them fully engaged in the process, connected with the company, and feeling that they were supported. We used surveys to gauge the state of our workforce throughout the remote work, and so on. The other challenge that we needed to be conscious about, it's the first time that we really had to implement such a wide-ranging virtual work environment. So again, the exposure to potential cyber issues was also a concern. So making sure that our network was robust enough and would allow us to protect client information and material information from the company was also a key concern. And the other thing that we did is we purposely split our return to work plan from our recovery plan, because we saw that the recovery was really the longer piece of it that would probably last for 12 to 18 months. But the return to work was more immediate, more short term, but we still needed to continue to assess risk, continue to assess the mid to long term impacts on our workforce, whether it's mental, financial, personal situation. We talked about the new norm where more people are going to be comfortable working from home. What does that mean to our workforce? And finally, being able to assess how our clients are being affected by this. Will their priorities change? Will their procurement approach change? How is that going to affect the type of services that we provide to clients in the long term? So that was really the risk dashboard that we maintained, that we briefed the executive team initially every day, and now we've scaled back to 3 times a week, and we'll probably maintain that throughout the transition.
Great, thank you, Richard. So Chris, back to you on this one here. We've all been grocery shopping since this happened, and we've seen how drastically things have changed, right? You walk in the store, there's directional arrows, they've got hand sanitizers out usually, there's plexiglass when you get to the cash registers. So, they were one of the first industries to adapt and adopt. So what can all employers learn from the lessons that they've already learned?
Yeah, definitely have my weekly trip to the grocery store, although my online shopping habit has developed quite nicely as well. But you're right. I think grocery stores and some of those essential services from a consumer retail outlet perspective needed to adapt very early on. And so we can learn from the lessons that they've learned along the way. They've refined some of their on-site tools. So like you mentioned, the plexiglass, directional arrows to control traffic in their workplaces. I think scheduling and placement of staff has been very thoughtful. So these are all lessons that we can take into our workplaces as we prepare to reopen or invite employees back to the workplace. So again, looking at HRPA as an office environment, we're considering directional arrows on the floors. We don't have particularly wide aisles. And so to avoid the passing of employees in the office, we're looking at the placement of workstations and desks in the office, and how do we ensure the appropriate proximity between employees while they're working, while they're present in the office. And signage, I think signage, and Richard said it a few times in his commentaries about communications, and really leading with a strong communication plan. And I think, again, when you look at the grocery stores, they've been very communicative, not only, I'm sure, with their employees and their own workforces internally, but also with their customers and I'm sure the delivery services, their supply chains. They've had robust communications plans, and they've worked collaboratively with all of those groups. So these are all things that we can learn from, that we can adapt and adopt in our own return to the workplace plans. There's nothing to say that putting arrows on the floor to direct the flow of traffic is inappropriate in an office environment these days, or site controls and monitoring how many people are in the workplace at any given time. Those are things that a lot of offices haven't done traditionally that may want to look to start implementing as they plan to bring employees back to the workplace. So lots of really good lessons. I think we've been exposed to it, and maybe in the early days it was new and a bit strange, but you know, we're 2.5 months in, and I think it becomes part of our experience. We've accepted it. And so we may not be paying as close attention to it anymore, but as we prepare to bring our employees back to work, as we prepare to bring customers and visitors back into our workplaces, let's look at those tools and those systems that are in place in other areas, and with fresh eyes, with a fresh perspective, and see what we can do. And to prepare early as well. I think if you've got to order things like plexiglass barriers or PPE, there's going to continue to be a very high demand for those things. So if you have a plan to bring employees back into your workplace by mid-June or the end of June, you should have those things probably ordered already. You know, who knows what the lead time is in terms of delivery or getting the appropriate quantity of supplies that you might need. So lots of lessons that we can learn, lots of controls and tools in place that we can adapt for sure.
Fantastic, that's great. One quick follow-up question for you, Chris. If you know, some of these changes will be very different for employees in terms of their experience in the workplace, and some of them will just resist. So you know, it might mean that you now have to take the long way to the lunchroom or the long way to the restroom. So how can you kind of coach your staff to make sure that they, you know, because some of them are just going to flout the rules. So how do you enforce that in the workplace?
Yeah, enforcement, it will really be key. Whatever policies or guidelines business puts in place, they have to be willing to back it up and enforce it, manage it, monitor it. So again, communication is really key. You need to engage your supervisors, your managers to help with that. Obviously, you can't have kind of the top decision makers at every corner of your workplace. So you need everyone to really agree to and accept those new guidelines and understand the importance. And I think I'm optimistic that most people understand why these things are important in particular right now. But I think it also begs the question is, just because you can bring employees back to the workplace, the government is lifting some of these restrictions or loosening some of them, should you? We heard a lot of your quotations from you know, business leaders in your presentation, Todd, adopting more flexible work policies and remote working policies in a long-term or more permanent sense. So, you know, just because you can doesn't mean that you should. And anticipating that there are employees who are not going to be comfortable and maybe they don't need to. And again, Richard said this point in some of his commentary. There are some people that can't wait to get back into the office environment, and others who are happy if they never go back. So the key is being flexible, communicating well, and making sure that everyone involved understands the importance of awareness and compliance with these rules.
Sure, and Ken, let's continue with that theme. So, you know, we know that the best practices aren't what the paper they're written on, right? If they're not followed. So how can employers ensure that their staff, some of them are afraid of returning to work because they have fears of the coronavirus. Some of them are very dismissive of it because they just don't believe it's a real thing. So how can you ensure that you take all the proper precautions?
Well, you're very right, Todd. There is a theme here, and both Richard and Chris have spoken to it. And it's communications and behavior change, and not the easiest things in the world to do to change behavior. And Bill Gates was famous for once saying that we've got to put a lot of money into changing behavior, and that's going to be the truth and reality for most businesses as they get going now. I'd like to really reinforce the comments that were made about communications plans. They're really very much essential to dealing with rumors and misinformation and quelling the fears and anxieties that people are naturally going to have as they come back into the workplace setting. And it's going to lead to the better productivity if we do it right and reassure people of what we're doing to control things. And let's face it, leaders have to show up at this time. Crisis periods are times when leaders come forward. We've seen it politically. We've seen it from our public health officials. And those folks have garnered a lot of support from the public in general. And so, you know, the baton is being passed now. It's going from the leadership in politics, the leadership in public health, and it's being passed back to business leaders as we get the economy restarted here. So it's much about engendering trust. It's about culture, because culture delivers on performance and strategy will direct it. Having a key strategy in place that's going to be effective on a communications basis is going to make all the world a difference. Chris, I think, kind of referred to this, is that, you know, you need to be prepared to act for situations where people are really not complying with your rules in the workplace. You know, a number of our clients have gone to the extent, say, for example, at a remote mine site, where somebody wouldn't play the game in terms of wearing a face mask or in an appropriate setting. They've been invited to go home. And, you know, you need to go there potentially, because this has to be taken seriously. The other workers need to see that you're taking it seriously. And, you know, don't go overboard with it, obviously, but be prepared to act when you need to act. There's a slide I'd like to share with you, and if we could go to that now. It's about the satisfaction with the response to the COVID-19 outbreak. And this is just meant to be illustrative of the degree of satisfaction that the general public has in the Atlantic region, represented here, from a political, provincial, and federal, and the healthcare system responsiveness. So this just goes to show you, if you do it right and you put the proper measures in place, people are going to be confident, they're going to be reassured, and they're going to be productive in their workplace. So that's a very important consideration for all of us as we get on with the planning for the return to work. So seize the moment, reinforce those public health messages that are so critical and important. The hand hygiene, the respiratory etiquette, staying home when you're ill so that you don't transmit the virus to other people. All the things that you've been hearing Dr. Tam talk about, and your provincial and jurisdictional medical officers of health, you know, those messages continue to need to be reinforced at the workplace setting. I want to talk a little bit about mental health impacts as that relates to return to work considerations, because there's a lot of fears out there. There's the fear of the infection, there's the fear of the impact on the severe form of the disease, either if it affects a member of our family or somebody close to us, you know, and there has been a relatively high mortality rate with this virus. The fear of losing jobs is very real for people. The fear of the economy and what's going to happen if we're going to be in a recession and worse, you know, and what to expect in the new norm. These are all going to be built upon people's past experiences, the trauma that they've gone through before. Some of us have lived through SARS, and in some bigger centers like Toronto and elsewhere where SARS was endemic, you know, this is bringing back a lot of frustration and concern for people, and that's going to present in the workplace. So you need to have an ability and a responsiveness to be able to help people out when they decompensate or if they decompensate. So, you know, managers and supervisors play a very critical and important role in that. And you need to take advantage of your ramp up time as you return to work now to do the things that are going to be conducive to successful results. So while you're getting back up to normal and things are just slowly returning, take time to clarify roles and responsibilities and the tasks and expectations for the ramp up period. Try to rebuild your stamina and flexibility and strength of your workforce, because there's deconditioning that's gone on over this time. There's physical deconditioning to a certain extent. People haven't been as physically active as they normally would. There's mental deconditioning. People may not be as sharp as they were because they've been lounging around perhaps a little bit more if they haven't been working from home. and social deconditioning. You know, people just are out of social context now, and they're going to be in a new social context. So you have to give some attention to that aspect of it as well. And think about cross-training for the future as well, because if in the unfortunate circumstance that we get into another pandemic scenario, you know, people are going to be out of work again. So if you can get your workforce cross-trained, that will help you with sustainability and resilience. Reconnect with your work groups. So, you know, make sure you're having those regular meetings and that you're keeping touch with people, and identifying the need for extra support and supervision that happens. And a lack of ramp up is potentially problematic because it can result in dysfunctional behavior. So people getting upset with each other, not understanding what's required of them, not responding appropriately to the measures you're putting in place, and getting into arguments and disagreements. And it can, at worst case, it can lead to mishaps and injuries. So people not paying attention to what they're doing in the workplace and create expensive errors and quality problems and rework potentially. So we all want to be successful in this. And there's a quote that I want to share with you that was an anonymous quote, but I thought it really summed up what's important now. And success isn't just about what you accomplish in your life, it's about what you inspire others to do. And at this time in our experience, in this juncture, inspiring others is what's very much essential to having a successful return to work outcome. And I'd like to move on to the next slide now, which is just a reference that a resource that our company has provided. It's in your package. The COVID-19 Return to Work Guiding Principles by Medisys and TELUS Health are there for your reference, and I hope you find it useful. Thanks, Todd.
Great, thank you, Ken. So we're just about out of time, Richard. I know you have to jump off right at 10 a.m. So if you need to jump off, go ahead. But I would like to take a question from the audience or two if we've got just a couple of minutes. So Kyle, if you can kind of let us know what's out there.
Yeah, for sure. Todd, this is some great information, by the way. Thanks, panelists. So this is probably to Dr. Ken. It almost seems that any symptom is a COVID-19 symptom these days. If a worker has allergies, presenting with a cough or runny nose, do we send them home for 14 days?
Yeah, that's a great question and a common one that I get. Let's talk about the allergy perspective. You know, you need to make it, because it is allergy season right now, and you need to make it relevant to the past experience of the individual. So there's a certain amount of self-judgment that's going to go on in managing this. So I'm an allergy sufferer, for example. I know what my symptoms are. I have a birch tree allergy, and the birches are just blooming here in Newfoundland now. I know you guys in Ontario are ahead of us. But if I get sneezing, itchy eyes, a runny nose, that's the same as every year it was before, I'm not going to worry about that. That could represent a COVID symptom in somebody who never has had those types of symptoms in the past and would need to be treated carefully. And, you know, it's getting advice when it's uncertain that's important. So if it's a new symptom, it's more likely to be of trouble or concern. And then, you know, reach out to an 811 line, a healthcare provider, an assessment center, somewhere that can give you professional advice about whether you need to be concerned about it or not.
Great, thank you. One more question here, and then we'll go on to our next bit. For those businesses with limited resources, how would you suggest tracking questionnaires?
And is that a question for me, Kyle?
Whoever, Chris, if you
Chris,
look like you have something to say.
Chris.
Yeah, you know, it's a great question, and I think necessity breeds invention. So I think whatever these businesses can do to either, you know, use some of the free resources that are out there at public agencies. It looked like the one, I haven't looked at the one that Ken shared from Toronto Public Health, but that looked like a mobile app of some sort. So there are lots of free and complimentary resources out there that businesses can use for no cost. And I think that, you know, you have to, with financial constraints, as a lot of businesses are experiencing, of course, you have to be smart and wise in terms of where you put your dollars and take advantage of some of the free resources that are available to you. And I think, you know, again, communication, I know it's a recurring theme in our discussion today, is free. So, you know, whether it's sending emails, whether it's, you know, having team meetings, conference calls, whatever it is, you can communicate a lot of your expectations, a lot of your guidelines with your workforce, and establish those protocols early on. I guess that's off the top of my head, kind of the two key pieces of advice. Ken, I don't know if you have anything to add.
I think
Well, I
you
think
hit the
that's,
nail on. Sorry, go ahead, Carl.
sorry, go ahead, Ken.
No, I was just going to add, I think you hit the nail on the head there, and you know, use the free resources that are out there. The Public Health Association of Canada will have resources. The Centers for Disease Control in the U.S. has a lot of great resources. So, you know, please do maximize the use of those.
Great. One more quick question here. The answer might not be quick. If office workers can work well from home, do you foresee sending them back prior to a vaccine or reliable treatment? What about people struggling to work from home? Should we facilitate their early return?
Yeah, I think that's those are questions that a lot of office-based organizations are contemplating, and it comes down to flexibility. It's kind of a little bit from all of those columns. So you have to work with your employees, work with your workforce, and again, you know, if just because you can, should you, if employees are working well from home, then I would encourage businesses to consider making work from home or remote work arrangements semi-permanent. You know, even if they're not ready to commit to it in a permanent sense, at least make it semi-permanent until there is a vaccine, a reliable vaccine that's widely available. You know, again, it's I think it's case by case, it's business by business making those decisions. I know, you know, at HRPA, it's a discussion we're having. We haven't made any decisions yet, other than to say, you know, our workforce, we're continuing remote work locations. Our office has been closed since March, and we won't be reopening it before Labor Day. We've made that decision regardless of what the government guidelines come down in the meantime. So, you know, I think giving employees that peace of mind and creating some clarity amongst all of the uncertainty will also help in terms of managing that back to workplace plan.
Ken, anything to add to that?
Yeah, I believe that where workforces can continue to work from home and be as productive as they need to be, that is an appropriate response. One, in terms of the second part of that question, in terms of somebody who wants to come back to work, but the employer may not want them to come back to work, one of the considerations there is their vulnerability to this illness. And there are certain factors that make people more vulnerable to getting sick with this virus. So you may want to think about a process whereby you ask people on a voluntary basis to self-disclose whether they feel they're in a vulnerable category or not. And you can find these criteria online fairly easily. So that is an extra consideration that should be given when you're considering those factors as well.